Have you ever gone to the dentist already knowing what you want to hear? Maybe you've done hours of Googling, watched a few TikToks, and now you're just looking for a dentist to nod along and confirm it. That's called confirmation bias, and we see it in dentistry all the time. Confirmation bias basically means we pay attention to the information that agrees with what we already believe and kind of tune out anything that doesn't. It's human nature, but when it comes to your health, especially dental health, it can sometimes steer you in the wrong direction. Here's one of the most common examples. Patients who walk in thinking the best solution is to just pull all their teeth and get implants. The thought is, if I do this, it's one and done. No more problems ever. But sometimes when we actually take a look, the teeth are healthy and fixable. In those cases, implants may not even be the best option. Veneers or crowns might give you the smile you want while letting you keep your natural teeth. And that's why we're lucky to have prosthodontists like Dr. Lazaro and Dr. Saeed on our team. They're specialists in restoring teeth beautifully without having to take them out. Now, don't get me wrong, full arch implant treatment can be life-changing for the right patient. But will it satisfy everyone? Absolutely not. Going from natural teeth to implant-supported teeth is a big adjustment, and there's a big learning curve as well. We've had patients who went from almost no teeth to a brand new smile with all-on-4, and still felt like something wasn't natural. People sometimes forget that even a perfect result doesn't always feel exactly like the real thing. And here's something else to think about. People are living longer. The real goal isn't just fixing things today. It's keeping your quality of life great all the way until your last day. Once your natural teeth are gone, they're gone. But if we can restore and maintain them for now, and later down the road, we do need implants, at least you still have that option. The challenge is, not everyone wants to hear that. Some folks only want implants, and when we recommend saving their teeth instead, they head down the street to find someone who will say yes. Here's another one. FP3 or All-on-X style teeth remove too much bone, so I only want FP1, or teeth only. Here's the thing. FP1 and FP3 are completely different treatment approaches, and most patients are not great candidates for FP1. For FP1 to work long-term, the stars really have to align. Here are the requirements. 1, you can't show too much gum when you smile. 2, you need most of your natural teeth still there. 3, you need thick gums, solid bone. And 4, the implants basically have to be placed perfectly. And let's be honest here, there's always some degree of human error in any procedure. When FP1 goes wrong, it tends to go really, really wrong. The problem, there's a lot of marketing out there that spins FP1 as the better option, or offices slap a trademark on an FP3 protocol to make it sound like something brand new. The truth is, it's usually just clever branding. Don't fall for it. We'll be doing a full video breaking down FP1 versus FP3. But for now, remember, just because something sounds better than advertisement doesn't mean it's the right choice for you. Another classic one, patients asking for permissions they know we're going to say no to. Like, can I eat crunchy tacos the week after surgery? Or, I'm still smoking a pack a day. That's okay, right? Deep down, they already know the answer. But they're hoping we'll say what they want to hear. But the truth is, our post-op rules aren't there to torture you. They're there to protect your implants and make sure everything heals. Break the rules and you're not just risking your investment, you're risking the success of the whole treatment. And honestly, it shows up in lots of other little ways too. I just want the cheapest option because implants are all the same. They're not. The planning, the surgery, the prosthetic design, those things matter way more than the name on the implant. I saw an ad for permanent teeth in a day, so I want mine tomorrow. This is where confirmation bias meets instant gratification. Yes, same-day teeth are possible, but they're not magic. Healing and bone integration take time. Rushing can set you up for premature implant failure or peri-implantitis, which means inflammation and possibly bone loss around the implants. If I get implants, I'll never need dental work again. Nope. Implants are amazing, but they still need maintenance, hygiene visits, and good home care. My friend had all-on-4 and never had an issue, so mine will be the same. Well, every patient is different. Anatomy, health, habits. What worked for one person isn't guaranteed for another. At the end of the day, our job is to give you an honest opinion, not just what sounds good in the moment. And if you disagree with us, that's okay. You can always get another opinion, but the best decisions happen when you look at facts, not just feelings. So, if you're thinking about a big dental procedure, ask yourself, am I open to hearing all the options? Or am I just looking for confirmation of what I already believe? And here's one more tip. For extensive treatments, it's not a bad idea to get a consultation or several with someone who can play devil's advocate. Someone who can step back, look at things more objectively, and help you balance what you want with what's really best for your health.